All attendees are in listen-only mode.
Good afternoon, and thank you for attending the STN monthly webinar. This session is being recorded so that it can be offered as on-demand CE for our members. Your lines are muted, but if you have any questions during today's presentation, please type them into the question queue and they will be addressed at the end of the presentation, time permitting. STN is an accredited provider of continuing nursing education. To claim CE for this session, you must attend the entire session and complete the online evaluation of the presentation. If you are attending this session live, you will receive an email about 1 hour after the event with directions to complete the evaluation. Your CE certificates will be emailed approximately 7 to 14 days after today's event. If you are viewing this session as on-demand CE, you will be able to download your certificate after completing the quiz and the evaluation. We hope that you gain great value from our educational session today. The presenters today are Caroline Baines and Maxine Wanzer. Caroline is an acute care nurse practitioner team lead for the Trauma Intensive Care Unit at Vanderbilt University Medical Center in Nashville, Tennessee. She completed her BSN at Lipscomb University in 2006 and her MSN in acute care at Vanderbilt University School of Nursing in August of 2007. Caroline's professional experience includes working as a trauma ICU RN and an ACNP in both trauma acute care surgery and the surgical ICU. In the SICU, Caroline's expertise as a critical care intensive flourished, and she eventually took on the lead role for the SICU ACNP team. During her 5-year tenure in the SICU, she led a team of ACNPs as well as serving as the co-chair for the Process Improvement Committee. In February of 2016, Caroline was selected to be part of a new ACNP team that was implemented in the trauma ICU and was immediately selected to lead the team. Caroline has been an integral part of the early success of the team, as they have proven that ACNPs can positively impact quality and continuity in the trauma ICU while improving consistent patient care, nursing satisfaction, and the physician satisfaction. Maxine is a critical care and trauma nurse practitioner. She works for Trauma and General Surgery Services at Grand Medical Center at Level 1 Trauma Center in the Medical Intensive Care Unit at Riverside Methodist Hospital in Columbus, Ohio. Maxine is passionate about continuing education and process improvements. Founder of a monthly journal club and participant in the didactic learning program designed for new graduate APPs, she also participates in peer review, continuous performance improvement, in the research and development of departmental guidelines. Maxine received her BSN from the University of New Hampshire and her MSN from the University of Pennsylvania. Please welcome Maxine and Caroline.
Hi everyone, this is Maxine. As mentioned before, I work in trauma and medical ICU at Ohio Health, and I'm going to be talking to you about becoming a successful clinician and transitioning into leadership from a new to practice APP perspective. So that's me. I've been practicing for about 3.5 years. Yeah. So today we're going to talk about what it means to be a successful clinician, the barriers that will kind of keep you from becoming a successful clinician as a new to practice APP. And then Caroline will be talking about it from experienced APP's perspective. We're going to discuss the leadership role of the APP and barriers that will keep you from becoming a leader, and then also about characteristics of a successful leader. I have no conflicts of interest, nothing to disclose, and this is how you successfully complete this course. So what does it mean to be a nurse practitioner? So this definition will vary depending on who you talk to, your perspective, your experience, but the AANP defines it as an expert healthcare provider, someone who ensures the highest quality of care. APPs undergo rigorous national certification, periodic peer review, your clinical outcomes are evaluated, and you adhere to a code for ethical practice. Part of being a nurse practitioner means self-directed continuing learning, and professional development is essential to maintaining this competency. Reading through the literature, just preparing for this talk, I found this definition that I really liked here. And I think this really talks about how NPs move between nursing and medicine. We kind of blur those traditional models of practice and culture and provide a holistic care to our patients. So what does it mean to be a successful APP? I think this definition will vary depending on your perspective, your experience, but I think being competent kind of plays a role in that, being confident in the care you're providing in yourself, being supportive of the people that you work with and feeling supported by them, being respected by your peers, and the other staff, the specialty services, nursing, respiratory therapists. Having a good idea of yourself, having good self-awareness, knowing who you are, being able to practice autonomously, but also being able to say, I don't know, and knowing what your resources are and who you can go to or where you can find the information. So what are the barriers to success? Again, pretty subjective, but things that I found in the literature, things that I've experienced. For sure, resistance from physicians, nursing resistance, lack of understanding of what your role is as an APP, I think definitely can be a barrier to your success. If you limit yourself, if you're not prepared, and if you're not supported as a new to practice APP, all these things can be a barrier to your success. So just to talk about physician resistance, I've been really lucky at Ohio Health. This isn't something that I sort of battle with on a regular basis, but I know that this is something that probably APPs have to deal with. And there's a threat to physicians, whether or not it's taking away from the workload. If there's a residency program at the hospital that you're at, maybe a concern that you're going to take away from procedures or the skills of the residents. Maybe the physicians are concerned there'll be loss of their activity, loss of their productivity, their income. And I think that that's something that making yourself aware of your value and how you can add to the income of the physician, how you can help them see more patients, increase their revenue, can help you to succeed. There's a lot of maybe concern that your knowledge, your competence to diagnose and prescribe isn't there. Maybe not understanding how you're prepared in your role, your education, concerns about malpractice, what's their legal liability, finding out, in your hospital what that is, and then maybe the belief that their patients would be resistant to seeing you. And time again in the literature I found, great results with, and APPs are effective as physicians. Patients want to see APPs. Their satisfaction levels are the same. I think that we bring a lot of value, and knowing what your value is, I think, will help with this barrier. So nursing resistance. This is something that I've definitely encountered and I think is common. I think we've come really far in the culture of nursing. I was a nurse for 8 years, and when I started, there was a lot of sort of lateral workplace violence and bullying and hazing, and I think that we've come a long way from that, but it's still there. When you're new, the nurses that have been there for a while, maybe they have more experience than you, and as a new to practice APP, you only have a year of experience, and there's a nurse who's been there for 30 years and they have more experience than you, and that's a barrier to succeeding. I think there's a lack of trust at first, like building that trust, building those relationships can definitely keep you from succeeding. I think if you worked at a hospital and now you're coming into, you were a nurse at the bedside and then you became an APP, that can definitely be a barrier as well. That can be a struggle. Lack of understanding of the role. Like I mentioned earlier, there's sort of a blur of those traditional boundaries of nurse versus physician, and patients often don't understand the role. I think there's a confusion, what's a nurse practitioner? What's a physician assistant? Where's the doctor? What's the difference? So learning how to face that challenge, how to explain your role and make your role understood. It can be very confusing when you're new and you don't really understand your role. So self-limitation, not being self-confident. If you have all this experience and all these achievements, but you're not self-confident, that can keep your your efficacy. Not putting yourself out there. I think a barrier to success is not giving yourself new opportunities to grow, not being prepared. Maybe you're starting in a practice of cardiology and not being prepared, for things like EKGs, or starting in a pulmonology practice, not being prepared about looking at chest x-rays. So if you don't have that self-motivation, I think that can keep you from being successful. And also if you have an unrealistic expectation of yourself. When you start, you're naturally going to be slower than APPs that have had more experience than you, and maybe thinking that you're going to achieve to that high level can be really hard on your self-confidence. I think a lot of APPs in school, you were, as a nurse, as a bedside nurse, you were an expert, sort of Benner's expert, novice to expert. You felt so good about what you were doing. Maybe you were a big fish in a little pond, and maybe now you're a little fish in a big pond, and suddenly you're the novice all over again. It can be really hard to deal with emotionally and becoming successful. There's this imposter phenomenon that's been talked about in the literature, and it's there when you're a nurse. If you think about when you're a brand new nurse, you think, well, I'm not supposed to be doing this. I'm not a real nurse. And the same thing happens when you start all over as a new APP. I remember thinking, what have I done? Like, why did I do this? Why did I go to school? I'm not a real NP. I can't do this. And just giving yourself a year or even two just to be patient with yourself. So just coming back to talking about being not prepared, not only if you're not preparing, that can keep you from being successful, but if maybe your educational program didn't prepare you for the position that you are choosing. If you didn't do a fellowship program, there's a lot of research out there that says the fellowship program can help with the success of new to practice APPs. If you're starting in a hospital that doesn't have a structured orientation, maybe you're the first APP to start there, and it's never been done before, and there's not a structured sort of way to progress through being new and evolving. If your level of knowledge and your skills don't meet that job expectation, maybe there's this expectation that on day one you're going to see 20 patients. That definitely will keep you from being successful. Lack of support from your organization, like I talked about before, if there's never been a nurse practitioner, you're creating this new role, so you're trying to figure out how to be an NP yourself and then how to be an NP in this practice, in this hospital. Maybe there's a lack of a place for you in the healthcare team. They've never had an APP. If there's not a mentorship program, I'll talk a little bit more about that, but mentorship is huge, and it helps you succeed as a nurse, as a physician, as an APP. Again, that sort of horizontal violence, that workplace bullying, that will keep you from succeeding if there aren't any resources for you. And again, those unrealistic expectations that are kind of externally. When I was a new trauma nurse practitioner, I was a SICU nurse for 4 years and an ER nurse for 4 years, and I had never taken care of more than 5 patients. And at night on our trauma service, we were in charge of anywhere 40 to 80 patients with a physician, and that was so overwhelming for me at first. And I think that there was this expectation, that of me succeeding, of myself, and also of the hospital that I was working for. And they pulled me in, and 3 months into my orientation, they said, we feel like, you're not doing well, seeing all these patients at night, you're not organized, what can we do to support you? What can we do to help you? And having that support, feeling like they wanted me to succeed, was so helpful. But I could say at that point that I felt like it was unrealistic for me to succeed right away, to see that many patients and be in charge of that many patients when I had never had that many. So finding a way to improve my organization role and gain help and have resources with another APP really helped with my success. So just to talk about mentorship, there's so much out there that says that mentoring can help you succeed. Not only having a formal mentorship program, which I think if you don't have, you should encourage your manager to start, or maybe you can start it. If you're a manager somewhere, creating this mentorship program will help with satisfaction and help with the success and the retention of your APPs. I think that I had a formal mentorship program, which was so nice to have that support there. And then I have multiple formal mentors that without them, I mean, I wouldn't be the nurse practitioner I am today. And I still call them, I still text them when I have questions about things. So how do you become successful? I've talked about this kind of as I talked about the barriers, but being aware of yourself and what your strengths are and celebrating those strengths, celebrating those victories. We focus so much on the negative when we're learning, when we're new, just focusing on those positive things. Maybe your patient, gave you good feedback. Maybe one of the physicians said something good. Maybe you caught something and that there was a good outcome. But writing those down and celebrating those, I think, are huge. Don't be afraid to ask questions. I think whenever you're new, people are going to trust you more if you ask questions, and they're going to see that you're trying to learn, and you know when, like I said, to be a successful clinician, you need to know when you don't know and know how to ask. Don't be afraid to think you're going to look dumb. I think people really respect that. Be humble. I think coming into it being too overconfident and having unrealistic expectations of yourself can be harmful. And be patient. It took me a year and a half, 2 years before I felt comfortable. It takes a while, and you're so used to being good at everything because you were so good at the bedside and being okay with not knowing everything and not being an expert. Find a mentor. Don't go out there and say, hey, will you mentor me? But maybe, finding that person that you notice is always kind of being helpful and supportive of you and asking them, can we grab coffee? Can we grab lunch? And if there isn't that formal mentorship program in your hospital, working on trying to get that established or just working to yourself to find that informal mentor. Being prepared. I think that's so huge. And saying yes to opportunities or procedures. Maybe it's something you already know or you've already done, but saying yes, or maybe it's something you feel like you'll never use. Being well-rounded and getting experience is the best way to learn and to become successful. So I read an article that talks similar about Benner's model of novice to expert. They talk about being in limbo and the sort of stages that an APP goes through. And I'll provide the resource for that at the end. But they talk about these are the stages that we've already talked about, but increasing your confidence. As you increase your confidence is sort of the middle ground from being a novice. And then you start to notice maybe the system problems. You've already started to feel confident in yourself. You notice things around you that maybe you can work on. Acknowledging what your strengths are, getting involved, and then adding new challenges to your role. It's so tempting when you finally get to that point at a year or 2 years to sort of plateau, but and just sort of feel, okay, I finally know what's going on. I finally feel comfortable. Add new challenges that will help you grow. Developing sort of a savviness in the system when you realize, like, hey, I know who's on call for this specialty service. I know how to get this x-ray done. You start to feel confident in those things, and you've developed some savviness. And affirming yourself, I think, is huge, just celebrating yourself and praising yourself. And then upping the ante, joining committees, forming committees, forming policies. Always growing will help you be successful. So just to talk a little bit more about being prepared, this is something that I do that I think is huge, is I keep a list of things at work to look up later. So if maybe we're talking about something at rounds, or I notice a patient has a condition that I don't recognize, I write it down in a little book, and I always go back and I look it up later. Staying up to date on research. The way I got involved, the way I feel like I upped the ante is I started a journal club. And, every couple months we would join and read articles, and one of the physicians joined us and helped us figure out how to analyze those journal articles. And that helps you not only feel like you're providing good practice, it builds your confidence. It shows to other people that you're really invested in the hospital and you're invested in your peers. Knowing your national guidelines and rules, I think that's really important. Your manager and the hospital will help you with those things, but you also have to make sure that you know them, because maybe they assume there's things you know or don't know. Making sure that you're accountable for yourself. Knowing your hospital policies. So moving on from being a successful clinician, I think leadership is a huge role in the APP world. And I think that I didn't realize how much I would be a leader when I was in school. When I went from being a bedside nurse to an APP, it just didn't click with me. I didn't understand how much I would be looked to as a leader. And I think that being a leader is a huge part of being successful. You're going to improve your patient outcomes if you have strong leadership skills, because you're guiding nursing, you're guiding ancillary teams. It increases safety of care. I mean, people are going to be more productive if they have strong leadership, and the team is going to work better together if they have someone that they can look to guide them and successfully lead them. It's going to help your professional accountability and advanced nursing practice. And the AANP just talks about why leadership is so important. And I've kind of already touched on that definition. And then one of the articles I read it was in Ireland, and they studied 23 nurse practitioners and what factors helped them become successful, what things were barriers to them, and I already talked about that. I think they're pretty similar with successful clinician and leadership, but the things that influence your ability to lead, having opportunities in your hospital to act as a leader. If you don't have the opportunities there, you're not going to probably be able to lead. If there's no role development in place and there's no mechanisms to sustain your leadership, you will be unable to succeed as a leader. And then the personal attributes of the APP can definitely apply. So having opportunities. Your manager, I think, plays a huge role, because if your manager is preventing you from becoming a leader, they're stifling that. You're not going to be able to grow. They should be providing you roles to influence policies, to lead nursing. They should, I think, very much provide a network. So developing that role, you need support, you need preparation. If you're overloaded in your role, if you're taking care of so many patients, you don't have that time to sort of develop that leadership, maybe getting involved in committees or doing some sort of professional time. Those things help to sort of develop yourself as a leader. If you're maybe the only APP, your role isolation, you don't have that networking to talk to other APPs and grow, managers should be providing professional maybe committees, or helping you go to conferences, or getting just sort of exposed to a wider group of professionals. So things that will help you sustain your leadership. Mentorship, again, is huge here. If you have a mentor that will help with your leadership, support from your management, and the protected professional time, sort of advocating for that, a few hours a week to work on those committees. If you're taking care of patients and working, staying overtime, you're going to get burnt out and not be able to dedicate that energy. You need that protected time. So personal attributes of a leader. Again, this is going to depend on your opinion. I think there are so many personal attributes that can make a great leader, but having team orientation, so really focusing on that teamwork, is important. Being aware of the political, cultural changes in your group, what's going on with the bedside nurses and what's going on with their development, what's going on with your peers, what's going on with the hospital. Being a catalyst for change. So not kind of being that person that says like, oh, we always do that, or oh, that's how it is, or that will never change. Being someone that really pushes for changes that will help your facility grow. Having conflict management skills, which is something that I've definitely had to develop personally. As a bedside nurse, you're not dealing with conflict as much as you are as an APP, I think, personally. And going to sort of educational opportunities to help you learn how to deal with conflict was something that really helped me, and with experience. Ability to build bonds, having personal relationships with the nurse practitioners, the PAs, the nurses, the respiratory therapists, that will help you so much, make you a successful leader. So just going to run through a few other healthcare related leadership articles that I read, but Forbes, these are the characteristics that Forbes sort of surveyed people, and people think that their leaders, the people they look to, should have these. honesty, the ability to delegate is huge. When you were a bedside nurse, I think you did all of the tasks, and having to take a step back and trusting someone else to do those things so that you can take care of the bigger picture. Being able to communicate exactly what you want and how to convey that, especially in a stressful situation, being confident in yourself and commitment to the patient, to the team, being consistent, being positive. If people are looking to you for leadership, they're going to be influenced by you, and if you're negative, that will spread, that feeling will spread. So providing hope, providing positivity, finding creative ways to solve problems, kind of having an intuition about how people are feeling, trying to spread inspiration and through the group. Another article I looked at, Harvard Business, they looked at the 5 major themes that made all these successful leaders across the world, and ethics and safety. So, you're wanting to lead and make the people that are following you feel safe, empowering them, communicating well with them, fostering learning and showing openness to new ideas, being a change catalyst, like I said, and nurturing their growth, and really focusing on the people that you're working with and being connected to them, fostering a sense of them belonging. So I asked my peers what they think I do that sort of displays leadership characteristics. I was curious, and I encourage you to do the same, because that sort of helps with what I've talked about, being aware of yourself, being aware of your characteristics. And these are the things that people that I asked said that I had, and I was surprised, and it really was, it helped with my confidence, it helped with my awareness, and it helps. I think we focus so much on what our negatives are, and we focus so much on developing our weaknesses. I think focusing on what are our strengths and how can we develop those. And of course, things like that are weaknesses, like conflict management, I had to work on those things, but I know that I always take initiative, and I'm accountable and consistent, and I try to bring humor to situations and positivity, and focusing on those and working on those, I think, have helped me start to develop and grow as a leader. So just a few things to help you if you feel like you want to work on your leadership, or you're new as an APP and you definitely want to develop as a leader. I think remembering, this is my personal thing, remembering people's names, the people you work with, and calling them by their name. I read something somewhere that people's names is their favorite word in the English language. So saying it will foster a feeling of belonging and help them feel good, and remember that they felt good when they were around you. Remember, what's going on in their lives, and listen to them. Communication is not just telling someone something, but listening to what they need and making them feel good. And then getting involved in activities, initiating change. We've talked about that, and taking responsibility for policy and guideline development, and knowing that you're a part of that and you can make a difference. Rising to the challenge, people will look to you as someone who is leading. Introducing new services, new changes, and being positive about them, and then mentoring people, your peers. Mentoring the people will make you feel good, will grow your confidence, and help you grow. Acting as a positive role model, getting involved, just getting involved once you've sort of, you've reached that year, you're starting to feel confident in your role, getting involved with a committee, starting a committee, getting involved with what's going on in your community outside of the hospital, staying informed about that. Those are huge things that can help you feel good and help you grow, help you become successful, and people will look to you as a leader. These are just some examples of what I'm talking about, opportunities. There are just so many out there. Getting involved in research, community outreach. I know our trauma center, we go to smaller non-level trauma hospitals and help with education with them. Things about preventing drug driving in our community and preventing texting and seatbelt outreach, things like that. Getting involved with that is huge. And then here are just my references. And Caroline, I'll let you take it away.
Okay.
Thank you so much, everyone.
All right. Hi, everyone. This is Caroline. I'll be speaking from the perspective of an experienced advanced practice provider regarding pursuing clinical success and evolving to a leader. Thank you, Maxine, for that excellent presentation. Even as somebody who's been, working at Vanderbilt for almost 10 years now, I think it's so good to kind of look back and maybe take a little trip down memory lane and remember what those feelings were like when you were new and learning and nervous, and kind of tapping into all of that to better your practice even 10 years down the road. I think that's excellent. Just a little bit more about my personal journey, or a little reiteration of it. I was a trauma ICU nurse for a couple of years and then moved on to be a trauma nurse practitioner for most of our step-down patients at Vanderbilt a couple years after that. And then I really missed critical care, so I transferred back to the surgical ICU. Our responsibilities there also included answering rapid responses throughout the surgical patients throughout the hospital, and then had the opportunity to help develop an ICU team for nurse practitioners and PAs on the trauma ICU. At that point in time, about 16 months ago, there was no ICU nurse practitioners or PAs on the ICU for trauma, and I had the excellent opportunity to help develop that. I entitled my presentation "Pursuing Clinical Success" because I think you should always be striving for clinical success. It might not be something that you completely always reach, but it should always be a goal moving forward, and you should never feel quite there. That way it keeps you invested and moving forward. First, just a couple of things. They're very simple, but sometimes easy to forget. Listen to your patients. Listen to the nurses around you. The patients, they're going to know themselves better than you know them. They know their bodies, what they've been through, sometimes than when you have first seen them. Regarding the nurses, even like small concerns, I will definitely go look at my patients and lay eyes on them. I'm blessed enough to work in a unit where all of my patients are in close proximity, so that's a little easier for me to do. But I feel that that's very important. Listen to your physicians, your attendings, and your respiratory therapists who are around you. Each year, we have new fellows that come through, and sometimes they'll, try to teach me, like I've put in, many A-lines, and they'll be teaching me how to put in an A-line. And even though I've done it hundreds of times, I'll still listen. I'm always going to learn a new trick, technique, or approach to a clinical problem, even if I think I know how to do it. So I just listen, always listen. Know what you know and know what you don't know. Always ask questions. Learn from your mistakes, because you will make them. You will make plenty of mistakes throughout your career, and that's okay. Sometimes we learn our hardest lessons from making those mistakes. If you ask questions, this shows your colleagues and the nurses that you're around that you're interested and you're engaged in bettering your clinical practice and doing what's right for your patients. Learn from those new clinical experiences. Not too long ago, I had a patient that came in with an acute head bleed from an outside hospital. Her outside hospital lab showed thrombocytopenia and a profound leukocytosis. It turned out she was having she had acute AML, and we ended up doing emergent leukapheresis on a trauma ICU. So not technically my general surgical concrete train of thought, but I learned a lot from that and looked a lot of stuff up. So learn from your new clinical experiences and internalize that to better your clinical practice in the future. Find a balance between confidence and humility, and this touches on a little bit of what Maxine was talking about. Have the confidence in your practice and your abilities to take action, but also, even 10 years down the road, have the humility to ask questions and just to be able to say, I don't know, let me learn about that. Let's put our heads together and figure out a solution to this problem. This is going to be different for each individual. Even, you know, when you've been doing this for a long time, there's no room for excessive egos in stressful situations or in our practice. Again, just ask questions. Be aware of your demeanor and your interactions with people. Maxine kind of touched on that positive energy, and I think that's very, very important. I kind of have to keep myself in check a little bit whenever I concentrate or I'm really thinking about something. Sometimes my face doesn't look as happy, and I think there's probably a colloquial term for that, but that I won't say. But I really have to be aware of of my face and the way I respond, because even if I'm not meaning something negatively, sometimes if I'm thinking really hard about something, I do that. So just awareness. It's important to stay calm in stressful situations. If your patient's heart rate is 10 and yours is 160, still just take a deep breath and stay calm. As a leader and as you're pursuing clinical success, it's really important to debrief yourself and debrief your team often with whatever clinical situation that you're in. What did you do right? What could you have done better? What are your goals moving forward? What is some positive reinforcement and positive feedback for yourself and for your team around you? And then also some constructive feedback. This is very important for team building. Have an emotional intelligence of yourself and your surroundings, and I call this kind of gauging the room whenever you walk into kind of a tough situation. Take the good and the bad, the emotional and the clinical, and use it to better your clinical practice in the future. Be aware of those defining moments. Have the emotional awareness and the cognitive awareness of those defining moments and those defining patients, and take that with you. This is Andy. He was a defining patient of mine. He on the surgical ICU. He was there for a total of 8 months, which is almost unheard of in any critical care unit. Maybe an MI, but not on a surgical or a trauma ICU. We just don't have patients for that long. But he, as we move forward with his care, as you know, he had multiple complications after complications, and then ended up trached. As our goals changed from, you know, I want to get better to I just want to go home, and if I get better, great. If I don't, great. And all of the things that I learned and from an emotional and a clinical perspective with this particular patient was just profound. And I really, at first, I kind of compartmentalized and blocked myself from a lot of the lessons that this situation could teach me, and then I just opened up to it, and I'm so glad that I did. So I just want you guys to be aware of those patients that can help define you in your clinical practice for the better of those in the future. Always have a plan A, B, C, D, and Z. Always think ahead and anticipate the next move. Not in a way that promotes anxiety. Sometimes I say I'm unfortunate, and I'm fortunate to think in worst case scenario almost all the time. I'm not an anxious person. I'm really calm. I'm a really concrete thinker, but I think it's just important to anticipate the next move if this solution doesn't work for this clinical scenario. Prevention of a patient arrest is always more difficult than the arrest itself. Once you get to the arrest, I mean, ACLS algorithm for that, it's harder to keep patients from arresting than when you actually get there to run the code. Be prepared with adequate equipment and staff. Know your hospital system well. When I was responding to rapid responses for the surgical patients throughout the hospital, I formed excellent relationships with the charge nurses, the clinical leaders on each floor, our administrators on call at night, bed management, anesthesia, cardiology, other consulting services, so that when I called them, they were like, oh, it's Caroline, I'm going to listen because this is important. So forming those relationships and being able to get your patients where they need to be, when they need to be there as quickly as possible is important. you need to always have a continuous desire to learn. I think sometimes we can become stagnant in this desire to learn, and maybe sometimes it comes in waves when you've been doing this for a little while. Working in an academic center is helpful for that because you always have stimulation, but always keep yourself open to learn new things. This is the greatest part of our job, that it's always evolving, it's always changing, it's always keeping us on our toes. Asked one of our late MICU medical directors, like, how do you stay up on all of this literature? It's so daunting sometimes to me, even after doing this for a while. And he's like, an article a day, that's it. Don't sweat it. Just an article a day, or an article, every other day, or a couple a week, however you see fit and what you have time for, but don't stress out over it. So communication is super important for clinical success. That positive closed-loop feedback with your staff, with your other leadership. Keep yourself accountable. If you say you're going to do something, follow through and do it, and then keep those around you accountable as well. Should let your expectation of communication be known as well to those around you. When we started out the advanced practice providers on the trauma ICU, that's a whole full team of residents and attendings and nurses who were not used to us at all. So sometimes I would get a patient up on the ICU and I would have zero communication from a physician or nursing, and I was expected to act as an intensivist and take care of this patient. And I just, addressed that and said, hey, I'm taking care of this patient sometimes by myself up here on the unit alone, so I need to know these things in order to best care for these patients. And if you always make it about the patients, which it is, and say this is the best thing to do for our patients, you'll get far. I think knowing how to handle end of life and family care at the end of life of a patient is very important. I know that a lot of this is from a critical care perspective, but it's something that I've had to work really hard on in the past 16 months because of the situations that in the middle of the night that I've been placed in. But I'm really, really thankful for it, for the opportunities that I've had to kind of build my skill set as far as talking to families and talking to patients. Super important to build the trust, be honest and realistic with the patient and those family members. Hope is good, but also keep that realistic perspective. At this point in time, a lot of times you're not just treating your patient, you're treating the whole family. And then becoming comfortable with not offering every single medical therapy available when you have, an unsurvivable injury, and just making sure that you're relaying dignity at the end of life and how important that is to your patient family members. Ask the patient and the family about the patient's personal interests and attributes and what they would be okay with or not okay with, should this injury prevent them from doing the things that they love. A great article regarding frailty that has really helped me talk to my patients' families and actually give them some data and some numbers was this article, and it's in my references, but it's regarding the pre-injury physical frailty and cognitive impairment among geriatric trauma patients and how that helps determine post-injury functional recovery. Something that I've had to do a lot of, and it's very helpful if you want to reference that. Compassion fatigue and burnout are something that especially those an experienced advanced practice provider needs to be aware of. I know that this has been a hot topic for the past year or so, but it is very important. You've probably heard a lot about it, but emotional exhaustion, depression, anxiety, sleeplessness, and then being overworked, those are all symptoms of compassion fatigue that can lead to that burnout and that emotional instability and all the things that go with it. Prevention of these things, kind of practicing an attitude of resilience, being cognitively aware that these things can happen, and that there are ways that you can prevent/intervene upon them. Practicing mindfulness, cognitive therapy, and utilizing your hospital's employee assistance counseling. There's no shame in that. We have all been burnout or had compassion fatigue before. It is very, very common. And then maintaining those personal hobbies. Having a personal life and work life and separating the two. Don't make your work your hobby. Have different hobbies at home. Exercise. And then always have personal and work goals so you can have that sense of purpose. It's very important moving forward. This is just kind of my words for interpreting evolving into a leader. I feel that it's crossing the bridge of bettering yourself as you try to do when you're a new advanced practice provider, and then to bettering yourself as well as others while you're improving patient care. A lot of what Maxine was saying, evolving into a leader, is getting involved. My involvement when I was I didn't really pursue leadership. I kind of fell into it, but did a lot of work with process improvement on the surgical ICU. It was me, a physician, and a nurse, and we were the co-chair of this process improvement committee. And we did so many things and worked very well together over the years to help develop different ways that we could just best take care of patients, and then also ways that we could help our fellows and our residents learn to the best of our ability to help them. One thing that we did, of course, as an ICU, we review all of our M&Ms. Well, when I first started on the ICU, it started out literally as a sheet of paper tacked to a cork board with patient medical record numbers on there, and that the new fellow would have to review. We noticed that this was technically probably not the most efficient system, so we would always make jokes about it. It became like M&M the Rapper list, and then Slim Shady, and then the 8 Mile list, and then we were like, hey, this is just not working. So we developed a data capture tool that was very fast, that the fellows could enter in and just look up, and actually captured some of the quality indicators and hot button topics that we were noticing and wanted to capture to better our unit. So that was just one big project that we worked on that really, really worked out well, and I think the fellows and the residents benefited from it as well. PI does matter. There's a great article on why PI matters, but the gist of it is PI is a backbone of providing high-quality ICU outcomes. It reduces cost of care, and it provides measurable processes and outcomes that you can take to your patients in the future. So it's super great and productive, and gives you a sense of purpose to get involved in. Also, involve yourself in the quality improvement projects. See how your PI and QI programs operate in your own institution. Identify problems, bring those to your programs, and be willing to be involved in helping to come to a solution. Involve yourself with things that you're passionate about. Find a mentor, as Maxine was saying, to guide you as you get more involved. That is so important, and sometimes very hard to find. But it's very, very important. Organize focus groups, ensure data capture and measurable outcomes for those projects that you're involved in, and then find creative and individualized ways to get buy-in from your staff and those around you, which is really tough sometimes, I know, but kind of gauge the room, gauge them, and see how they're best motivated. Speaking of data capture, when we did initiate the NPs on the trauma ICU, we did a quality indicator data capture, as well as like a more extensive survey. But even 6 months after we were there, we noticed a reduction in improvement in some of our quality indicator numbers. One of the biggest things that helped me kind of develop in my clinical practice and as a leader was guideline review. And I know it sounds super boring, but it was actually so helpful. When, as the co-chair, we kind of identified this process of how to develop a guideline and how to review it, and that's listed here. I think forming focus groups is one of the most important things. Formulating a vision for that guideline development and review, conducting an extensive literature review, which will absolutely help you in your clinical practice as well, drafting the guideline, and then presenting it to your faculty, which can be really intimidating. Be humble and accepting of constructive feedback when you do present anything to your faculty, but also stick by the evidence that you reviewed and be able to back it up to them. Once it's approved, communicate it effectively to those who it will affect. Go to conferences, network, submit an abstract, all of those things. Find a mentor that can kind of help you through that. Such great experiences, and you'll do nothing but get better at being able to do those things. I promise this is not a shameless plug for Vanderbilt, but I just wanted to demonstrate how capable nurse practitioners and PAs are at innovating in new ideas. About six years ago, there was a medical ICUNP named Jana, and she was, searching through conferences to go to, and she thought, there's just nothing really out there for critical care advanced practice providers that is just for us, like something just for us for critical care. So her and the late Art Wheeler kind of put their heads together, and April Kapu, who is another NP at Vanderbilt, and developed this small conference that about 50 people came to. And over the last, 5-6 years, it has developed into a national conference with over 300 attendings, people on the waiting list. We have 2 skills labs that includes central line insertion, art line insertion, airway management, ventilator management, simulation of clinical scenarios, and then this year we're introducing a new mini ultrasound course, and this is something that I am on the committee of, and that it's all NPs and PAs, and we develop the curriculum, we develop the skills lab, we develop everything. So I just think that's something that we are completely capable of, and don't set limitations for yourself and your teams, because you can do anything. I think a robust orientation program is essential for as a leader, as you're onboarding new people. Make sure that they have adequate opportunities to learn, have a weekly list of goals, have weekly constructive feedback, and then if you see that they are struggling, identify the needs and specific things that they might need a more individualized orientation, because you want them to be successful. As a leader, I think it's important to realize the difference between leadership and management, and just not that a manager can't be a leader or you can't be in leadership and can't be a manager, but just realize that there's a difference between the two, and that leadership is more people-oriented, and you empower and motivate change in people. You're not over employees, so you don't have subordinates, but you have like this creative, innovative focus that encourages people. So you lead with your team, and that you have voluntary followers. As the manager, presides over or in front of a team and has obligatory followers. I think acknowledging that difference is really important in your leadership role. Know your team well. Encourage the ideas, the growth and development, the projects in which each of your team members are passionate about, and encourage them to be leaders. On the surgical ICU, when I took over that leadership role, had a group of really motivated, excellent nurse practitioners, and they, all had very different strengths. So developed pillars of leadership. That way they could each have individualized items that they could just take and run with and provide leadership for all of us, and out into the hospital such as like the educational leader developed a journal club, and it was awesome. And then information and technology and billing, they helped us develop, billing strategies that helped us prove that we needed another FTE. So things such as that involve your team in leadership ideas. This is just a little a quote that I felt that from John Ron that I felt that exemplified leadership kind of to a T. It's all about that humility and confident balance. Some barriers of an advanced practice, many of which are the same as what Maxine was talking about with a new. The divergence of like the RN to provider or just a new provider, physician resistance and sometimes conflict, complacency, toxic attitudes. Proving advanced practice worth. Sometimes people, we have a little bit of role confusion and then you feel you're in this constant sense of having to prove your capabilities. Crucial conversations, compassion fatigue, and burnout. As we moved to the ICU where nurses were not used to having nurse practitioners and not really knowing how to use us, we definitely had to address and acknowledge a few things moving forward with that. The nurses didn't, they didn't know us. They didn't know if they could trust us. They also felt, we were a threat to their autonomy. Many of these nurses, go on to do nurse practitioner school or CRNA school. They kind of felt threatened. And then just realizing the differences in education and training and experiences. Again, the role confusion and importance of communication. It's important to ensure clear and direct communication regarding patient care and orders. It's important to have closed-loop feedback. With the nurses up there, once we kind of established what we were capable of, it was really important to guide and educate the bedside nurse in real time for something that they had maybe been struggling with or for a patient situation that they maybe needed some education on. And then follow up frequently, show that you care. Maintain your nursing skill set. I still sometimes put in IVs and difficult NG tubes and just or stuff a pillow whenever they're turning their patient. Just be available and keep up that nursing skill set. And then just realize that how you handle yourself in difficult situations, this can either build or break trust with the staff around you that you're working with. Also, the residents weren't used to us up there on the ICU or how to use us. And many of the issues that I ran into were things that Maxine has mentioned before. So ideas that we went with moving forward to kind of combat this resident conflict is that we developed an orientation by the advanced providers as they were coming onto our unit, just to kind of let them know about our role and what we did and what we were there for, and that we were there for them. Provide teaching and guidance willingly. We involve them in the critical thought process. A lot of times the residents are just really don't feel like they've gotten their critical care experience if they don't get to think through the critically ill problems. So allow them to make some decisions and even a couple of mistakes that they can learn from. Don't let them hurt anybody, but allow them that room for learning. And then build a working relationship with them, balance the procedural opportunities, and then in the end, just really take pride in being a part of growing a resident into a great doctor, because it's something that we can do. I'm going to skip forward. Just a couple of points on effects of toxic attitudes and complacency. It can decrease motivation, productivity, distraction. It curbs creativity, not only of yourself, but of those around you, because we kind of go into this like self-preservation mode when we get into that, stuck into that like negative rut, and it's just this negative, vicious energy cycle. So it's important to, acknowledge that sometimes these things happen and you're human. But also, encourage an environment where there's a free exchange of ideas and you can talk to each other. Empower those around you by involving them in projects that give them a sense of purpose and yourself. And then early recognition of those attitudes is important as well. And then just requesting and providing peer feedback. Goals moving forward for nurse practitioners is involving into leaders. I think we're in more nationally recognized positions. Ruth Kleinpill, awesome nurse practitioner, she was named the president of SCCM this year. I think that's incredible that an advanced practice provider is in that role. Advanced providers in politics, protect our profession in your respective states. Protect what we get to do, and just let your voice be heard, whether it be through emails or letters to your senators, or just paying attention to the potential policy changes within your state and be involved with that. Have a voice. I think we've come a long way in the past 10 years of incorporating advanced providers in critical care, and I think it's incredible what it was then and what it is now. It's just incredible, and I'm really, really proud of what we have done as a profession there. Get involved in policy change and improvement within your institution, and then involve yourself with research. Always have that work-life balance. My puppy over there in the upper right left-hand corner, and my husband, that's my life balance. And then this incredible group of nurse practitioners that helped develop this ICU role on the trauma unit are there in the middle, and I couldn't be more proud of them, and I couldn't be more proud to be their leader. So thank you so much for letting me speak to you today.
Thank you both very much. We do have a few questions I'll get to now. The first one is, I believe this was for Maxine. What is your organizational structure? Who do your MPs report to?
So I am transitioning from a role right now of trauma nurse practitioner to medical ICU nurse practitioner, but in the trauma world, I guess reporting to, I'm not clear what you mean by that, but so there's about 20 nurse practitioners that work in the trauma group at Grant Medical Center, and we have an assistant manager, nurse practitioner manager, and a manager, and we, report to them when it comes to, I guess, like scheduling and any issues having to do with like policy in hospital and things like that. And then there is usually about 5 or 6 NPs on every day, and then one attending, kind of managing the floor and the step down, and then another one managing the ICU and responding to traumas. So when it comes to patient care issues, I guess reporting to the attending, and then when it comes to anything else, the managers. I hope that answers that question. And then regarding the structure, is that what that other question was?
Yes.
So kind of like I mentioned, there's about 5 or 6 APPs there during the day, and then 2 APPs at night, covering the trauma service and responding to traumas, and then 1 APP covers the medical ICU at night. And there's always an attending available 24 hours a day, and then an intensivist available at night for questions if you're covering the medical ICU. And the medical ICU APP and the trauma APPs are kind of backing each other's up. If one person's busy in the MICU, both people are helping with that. If one person's busy in the trauma bay. And then we have an amazing residency program, and the residents cover the trauma ICU 24 hours a day, and they go to traumas, and we work together collaboratively. I hope that answers that question. Please let me know if you have any other questions about that.
Great, thank you. The next question is about the Journal Club. How often do you meet? About how many members? And are the articles presented, or are they shared for review?
Sure. So I can talk about the 2 different journal clubs, the Trauma APP Journal Club, and then recently got involved in the Medical ICU's Resident Journal Club. So the journal club I started at Grant, at first we started meeting like every other month, and it's not about members. It's for the whole staff, whoever wants to go. So there's always one of the trauma physicians, when she got involved, and she's helped to helped us spearhead and organize it. And she's there usually at every meeting, and then usually 3 to 5 people consistently come, but it's open to anyone. And as we've kind of gotten busier, we found that it was like harder to find times to meet. We were kind of meeting outside of the hospital. So what we started doing is we've added it to the staff meeting. So the journal club meets sort of at the end of every staff meeting, which we have monthly, and usually, about 10 to 15 people are there. And it's sort of an informal discussion of the article. So it's 1 or 2 articles that are sent out a few weeks ahead. The expectation is that you've read it, but then it's a sort of informal discussion of the article. We analyze it in this sort of like systematic way, but it's again, really informal the way we discuss it. And it's really nice. And whoever wants to maybe pick an article, or if there's a topic people want to talk about, we tend to talk about either like general surgery things, or like this last month we talked about sepsis and fluid resuscitation, so it really varies. And then the one that I've recently got involved with, the medical ICU, I noticed that's a little bit more regimented, and they had about 4 articles that they reviewed. They meet every couple months, and they had like a PowerPoint presentation, and someone was leading the discussion. So it's nice to see those sort of differences, and you can really just form whatever meets your group. I asked the group initially when I started the journal club, hey, would you guys rather meet informally or formally? Would you rather be a discussion, or would you rather it be like led? Would you rather it be here at the hospital or maybe at someone's house? So you can kind of form it to meet your needs, I think.
Okay, another question. Who can our PA or NP contact to attend the boot camp?
They can go to, they can actually Google Vanderbilt ACNP PA boot camp. It'll be the first thing that pops up. It's on the Vanderbilt Advanced Office of Advanced Practice link on just the main medical center website.
Great, thank you. We're actually out of questions. If you have any additional questions and you're watching this session live, you'll receive an email within 1 hour with instructions to complete your survey for CE. Just respond to that email if you have any questions for the presenters, and I'll forward that on to them. Again, thank you, Caroline and Maxine, for a great presentation, and I hope everyone has a good rest of their day.
Thank you so much.
Thank you, Cody. Thank you, Maxine.